the microphone though. First off, I will just say I'm Jenny Stiles. I'm the infectious disease nurse at Sarasota County Public Health. I started there back in 2012, and I was hired to facilitate the personal responsibility education program with the 8th graders. I struggled. The 8th graders could drain me of all energy in like one class period. So thank you for everything that you do for our kids. I could not do it. I will make this training quick and easy. If you have any questions, stop me along the way. Let me know. Okay, so bloodborne pathogens. So the reason the training is important is as teachers, you may come in contact with other people's blood. We will talk about how you could be exposed, precautions to take if there's a potential for exposure, and what to do if you are exposed. Am I going in and out of this too much? Am I? Okay. Okay, so fortunately with your positions and the individuals that you deal with, you're going to be at more of a low risk for exposure. However, there is still the chance that the exposure could be there. Okay, so what are bloodborne pathogens? Bloodborne pathogens are infectious microorganisms in other people's blood that you can come in contact with, and it can make you sick. So transmitted through sexual contact with your mucous membranes, such as a splash in your eye, your nose, your mouth, through open cuts or non-intact skin. And when I say non-intact skin, I mean like if you're a nail biter, if you have a scrape, something that maybe you wouldn't necessarily think of, might not be an area that's bleeding. Chapped hands in the wintertime are a good form of non-intact skin. And puncture wounds from sharp objects. And I don't know that are any of you, would you be dealing with the sharp objects, or would that be more like the school nurses that would be giving injections in Georgia? So anybody have an idea of what the 3 most dangerous bloodborne pathogens are that we worry about? Anybody? Okay, so HIV. I'm sorry. Go ahead. Yep. HIV, hepatitis B, and hepatitis C. So those are the ones we're going to talk about. However, those aren't the only infections that you can get from other people's blood. So syphilis, malaria, there are different illnesses that you can get if you are exposed just to someone else's blood. So body fluids. So we're going to think mostly bloodborne, so we're going to think blood. However, there's vaginal secretions, semen, breast milk, amniotic fluid, any feces or vomit that you might deal with that could be contaminated with blood. And just because you can't see the blood doesn't mean it's not there. And then we have deep tissue fluids. Those are going to be probably fluids you're not going to be exposed to unless you have a major injury at your school. But in everyday life, if you're out and about and you come across a car accident or something, you can easily come across any of these fluids from anybody, okay? Not a bad idea to keep a pair of gloves in your car. So we'll talk a little bit about HIV. Attacks the body's immune system. Eventually the immune system becomes so weak, they get another infection, pneumonia, something like that, an opportunistic infection, and they eventually progress into AIDS, which leads to death. No cure and no vaccine. However, with this, we're not too worried about being exposed. As of 2016, at the end of the year, these are the most recent stats that we have. 2,600 cases living in Iowa, 136 new cases in 2016. As of 2016, we had 25 cases in Sarasota County. You probably can't really see the map that well up there, but that's enough, okay? So there is a risk for exposure. This here just kind of gives you some interesting facts. About 1.2 million people in the United States are living with HIV at the end of 2012. That was going to be the most recent information that they have. 12.8% of people don't even know that they have it. So they don't know that they're putting you at risk if there is an exposure. So your chance of contracting HIV after having a cut exposure or a needle stick is fortunately very low, 0.3% or 1 in 300. A risk exposure after being splashed, like blood splashes in your eye, your mouth, is only going to be about 0.1%. It's going to be about 1 in 1,000, okay? And then risk after exposure to, if you have intact skin and you get somebody's blood that has HIV, it's going to pose pretty much no risk, okay? But that doesn't mean we don't still want to treat all people's blood if they're infectious. So other modes of transmission for HIV is going to be obviously unprotected sex, IV drug use, blood transfusions before 1985, HIV positive mothers to their unborn babies and breast milk. You cannot get HIV from casual contact. You're not going to get it from a mosquito bite. You're not going to get it from sharing utensils, eating utensils, anything like that. No toilet seats, doorknobs. I know people get a little creeped out by that, that you're not going to contract HIV that way. So if you're exposed, what's going to happen if you have a blood exposure is they're going to have you talk to Tom, probably, and you're going to go into probably HealthWorks is what's going to happen, and they're going to determine if a true exposure was had. If they can determine that there's a true exposure, I don't know what rights you have to records as far as, for us, if we were exposed at the health department, we would call that individual and say, are you willing to share your status with us? Are you willing to go in and have blood work taken so that we know your status, so we know what risk we're at? However, people don't have to provide that information. So what they would do is they would do a 2 to 3 drug regimen that would be within 72 hours of exposure, okay? Which is why it's important to make sure and let your supervisor know immediately after an exposure. So some of the people will have flu-like symptoms usually within 2 to 4 weeks. They'll have, just your night sweats, rash, fever, chills, muscle aches, sore throat. They might have some swollen lymph nodes. They might get some ulcers in their mouth. However, these people usually they'll have a window period at that time that they're not going to test positive for HIV. However, they're very infectious, and then they get better, so they don't think, after a few weeks they're like, oh, I'm better, I don't have anything, and then later on down the road they'll get sick again. Okay, so hepatitis B is going to be, with hepatitis B and hepatitis C, we're talking about inflammation of the liver, okay? This one with hepatitis B can be short term, however, 6% of the people will become lifelong carriers. That will eventually lead to cirrhosis or liver cancer, and neither of which we want. The virus can live on a surface for up to 7 days. That's one thing that's very important about this. There's no cure. However, it's vaccine preventable. So when I say vaccine preventable, most of you probably, when you begin employment at the school system, they give you a form that says, go get your Hep B vaccines or check and see if your vaccines are up to date. So that service is provided free to you, so you can come up to the health department, bring your sheet from the school, and we'll make sure to give you your Hep B vaccine. So it's 50 to 100 times more contagious or infectious than HIV, and this one is commonly spread through sexual contact too. So, which means, people don't always have to have the risk involved with blood-to-blood exposure, I guess, to put you at risk. So the two most important things here with hepatitis B is just remember it can live on the surfaces. So even if it's dry, it can live on a surface for up to 7 days. You can pick that up. And it's vaccine preventable. 16 cases of acute, which means that they are actively sick with hepatitis B, were reported in Iowa in 2015. Those are the latest stats that we have for this too. So 266 confirmed or probable chronic hepatitis cases reported in Iowa, which means that they've had it before, so they test positive, but they're not actively sick with it, but they're carriers. So your chances, if you have your vaccination, if you have your 3 doses of hepatitis B, your chances are virtually very low, okay? If you're unvaccinated, 60 to 30%, I would want to take a chance on the 30%, so I would probably just make sure I was vaccinated. So other modes, of course, unprotected sex is going to be the main route. IV drug use. This one here, you want to make sure that they're not sharing anybody's equipment at home, like toothbrushes, razors in the shower, if they have somebody in the home with hepatitis B, because they can become infected by using those. We are seeing, families will come over from other countries, and we'll see those are who are seen with a positive hepatitis B. It's contracted in another country. They come over here, they deliver a baby, and the baby's positive. So you're going to have the chance that this is going to be in students too. So hepatitis B positive mothers obviously are going to share this with their unborn baby, and then tattoos and piercings from places that are unlicensed and that. So, consider that when you're, finding that you're getting some of these older kids, the high school kids that are going and getting tattoos, they obviously can't go to a tattoo parlor that's licensed and inspected, but they can have a friend do it who has the equipment at home, and most likely that equipment is not going to be clean, sterile equipment. So, if you're exposed, they're going to have you go in, they're going to say, have you had all your immunizations? You had all your immunizations. They're not going to really worry too much about it. If you're not vaccinated, they're going to end up giving you an immune globulin, which is a big dose of it to try to get it so that your body will develop an immunity quick to it. And then they'll start the vaccination status for you. Symptoms are going to be depression, loss of appetite, nausea, vomiting, abdominal pain, fever, headache. All of these things we could mistake for other illnesses too. It's going to have an onset of between 6 weeks to 6 months. Usually about 3 months people will start showing symptoms. So by then you completely forgot about it, right? Okay, hepatitis C. This is going to be our most chronic, our most common chronic bloodborne infection in the United States. Obviously, again, inflammation of the liver can be a short-term illness. Most people, however, are going to carry it long-term. Majority of those infected don't know that they're sick because they don't get sick for a long time until it's really done some damage on the body and the liver. The virus can live on surfaces for up to 3 weeks, and it can live in a hub of a needle for up to a month. This is important, I think, because we have a lot of IV drug use in our community, and as much as I didn't believe it beforehand, and my husband was a police officer, and he would tell me, oh, we caught somebody down in the park doing whatever, and I'm like, that happens here? Yes, it happens here. And then when we started going into the jails, we go out to Prairie Ridge and we do HIV and Hep C testing for their residents or visitors, and find out that IV drug use is huge. So there's a risk of this anywhere. There's a risk they could be doing this on your playgrounds at night. While you guys are at home, they're hanging out at the playgrounds because they can't do it at home. They can't do it in public. So just remember this. If you do come across a needle, obviously it can live in the hub of a needle for up to a month. Most IV drug users, within 5 years, they're going to be Hep C positive. So there is definitely that risk there. Leading indication for liver transplants with hepatitis C, unfortunately, no vaccine at this time. Most important, you want to make sure that you know that it can live on a surface for up to 3 weeks and in the hub of a needle for up to a month. And no vaccine is available. This is not a very good, it just kind of gives you an idea. They're saying about, as of December 2016, there are about 24,000 cases of Hep C in Iowa. And they believe that 1.6% or 1.8% of the population that is infected, they don't even know that they have it, so they can't protect you. On the right-hand side there, you'll see the hepatitis C infections have nearly tripled since 2010. And this is going to be partially because of the increase in IV drug use, but also because we're testing more people, so we're identifying those cases. In 2017, we at the health department, we tested 162 individuals for hepatitis C. Of those 116 or 71% were IV drug users. Of the 116 IV drug users, 64% reported sharing their equipment with other people, which means they're passing it around. Of the 162 tested, 14 tested positive for hepatitis C, 6 of those people had viral loads consistent with an acute infection, meaning they just got sick, okay? So we know it's out there. So your chances of occupational exposure is going to be about 1.8% if you get stuck with a needle or if you get a cut exposure. If you get a splash exposure, it's in your eye, in your mouth, it's believed to be very low. However, there have been cases reported. So other modes are going to be sharing needles. Obviously, any drug equipment that they share, they're putting themselves at risk. Needle injuries in healthcare settings, Hep C positives, moms to their babies, sharing personal equipment, unprotected sex. And this one too, you can't get it from eating off of, eating utensils, doorknobs, toilet seats, hugging, kissing, all that kind of stuff. These are not spread by food and water also. That's a good thing to point out. Hepatitis A is, these two are not. If you're exposed, there's no post-exposure prophylaxis. The only thing that they can do is just monitor you for early onset of the disease. Just like with the hepatitis B and the HIV, you're gonna have symptoms similar with the flu or just, not feeling well. There is a new treatment for hepatitis C. It's called Harvoni. It's a combination antiviral medication, $78,000 to be treated. Yep. So the one thing with this is we try to get people in for treatment and that too. So if it's nice to know too that if they're a drug user and they have Hep C, they can't just go to the doctor and get Harvoni and be over with it. They have to go in and have drug testing done to show that they're able to deserve $78,000 worth of Harvoni. So, how can you protect yourselves from bloodborne pathogens? So obviously the universal precautions is really what we think about. We're assuming that everybody's body fluid is infectious, and like this little dental assistant down here, she's warm and friendly to patients, but secretly she thinks that everybody has HIV. Okay? That's a good way to think, okay? It will keep you safe. So we want to use personal protective equipment. So we have gloves, we have masks, we have gowns, CPR masks. Do you guys have access to those within your schools? I'm sure your nurse does. And your nurse is probably going to be the one, or your janitor would be the one that would take care of any kind of spills or anything. But if you had to provide first aid to a little kid that cut their finger in your classroom or something, obviously we want to have some gloves. They're going to be accessible. So hand hygiene is going to be one of the most important steps that we can do to avoid getting sick, okay? That is the most important thing to do every single day of your life, okay? Multiple times throughout the day. So even though if you use gloves and you discard your gloves, you still want to wash your hands with soap and water. If you don't have soap and water, hand sanitizer is available. But even after using hand sanitizer, you want to make sure that you wash your hands with soap and water. Hand sanitizer does not protect you from everything. Anybody ever had diarrhea that was uncontrollable and throwing up at the same time? Okay, everybody has. You had norovirus is what you had. And with norovirus, hand sanitizer does not protect you. And norovirus is so contagious that the top of a pin can make thousands of people sick. That much of it can make thousands of people sick. So when you go to the grocery store and you touch the cart and you touch the doorknob, if you're like me, I have hand sanitizer in my car. I get out in the car, I hand sanitize. It's not protecting me against norovirus. So keep that in mind when everybody's getting sick and you hear about everybody puking and pooping. That if it's in the community, wash your hands, wash your hands. So here, just kind of a neat little thing from the CDC. There's 1 trillion germs in 1 trillion germs in, I believe it's 1 gram of poop, which is going to be about the size of a paperclip. Okay, as much as a paperclip. So just keep that in mind. Because this is a good, I guess, place to maybe encourage you guys to push hand washing in your classrooms too. We find that like last year we had a lot of influenza in the schools. We had a school that reported one whole week. We got up to 18% of the kids were gone. We had schools in other communities where there were no substitutes because you guys were sick or you guys were filling in for everybody else that was sick. There was talks of having to combine classrooms just because there wasn't enough staff to go around. So, and a lot of the times we're getting things from little kids. That's why we vaccinate them and, try to teach them early. But they, a lot of the times, are the ones that are carrying these germs around. So, if you're having to clean up any bodily fluids, you want to make sure that you're wearing gloves. Make sure that if you're anticipating that there's going to be any splashing, if it's a lot, you're going to want to make sure you're wearing protective eyewear so it's not splashing in your eyes. And then a face mask. Your nurse should have those. Remove any garments that have been contaminated. So, if you're helping a kid and your shirt gets all bloody, we need to get that shirt off and get something else put on and get that laundered as soon as we can. There's a bleach solution. You can use a cap full of bleach to 1 quart of water, which is going to be appropriate for cleaning. However, your school is probably going to have a disinfectant that they're going to recommend that you use for cleaning. Allow the surface to air dry. Okay, allowing that surface to air dry. There's contact times with a lot of these germs. So I don't know if you remember a couple years ago we had a crypto outbreak. And so in order to kill this parasite, we have to kill this parasite by using hydrogen peroxide, but it's got a 20-minute kill time. That means that surface has to be wet for 20 minutes before that crypto is going to be killed in there. So it's just spray the area down with your solution and let it air dry. Anything that needs to be discarded that might be contaminated doesn't necessarily have to be in a red biohazard bag, but it does have to be in a container that can be closed so that nobody else can, obviously go over and grab it right out of there. So protect yourself. Don't eat, in areas where there's a potential for exposure. Obviously, don't eat, drink, smoke, handle anything in your eyes. And then remember that the pathogens can live on the surface for hours to days. If you think that you've been exposed, obviously, first thing we're going to want to do, immediately wash the area. We're going to want to flush the mucous membrane. If you get splashed in your eye, you're going to want, if it's in your mouth, you want to flush. Get as much out of there that you can. Ask for help. If there's somebody there that, you can't get it washed out of your eye, then somebody else can maybe take a cup of water and pour it over your eye for you while you're leaning over the sink. And then obviously first aid. Those are going to be your first top priorities. But then you're going to want to report that immediately to your supervisor, whether it be your school nurse that's going to take care of this for you or your principal. And that would be because there's prophylactic measures that have to be taken. And don't anybody be embarrassed. If you get exposed, it happens. And we want to do the right thing. We don't want to take any of these illnesses home to our families. So taking care of it right away is going to be your best bet, okay? I know, some people are like, oh, it was just a poke, it's no big deal. Or, oh, it was just a little bit of blood, it's no big deal. But let's not take any chances. So your role as an employee is to know what your risks are, and you do. Kids playing outside, getting hurt, a staff member maybe getting hurt. Like I said, you guys do get a lot of illnesses that go around, so you're probably exposed to diarrhea, you're exposed to vomit, all kinds of different things. And two, like I said, with your kids that are in high school and that, just remember, there might be some other riskier behaviors that they're involved in rather than, what your elementary and your middle school kids would be involved with. So they could even have equipment that they carry on them, in school. So just keep those things in mind. Immediately report any exposure. Obviously, we talked about that. Assuming all body fluids are contagious, using universal precautions or standard precautions, whatever you want to call it. Have your equipment available, which your schools will have your equipment available for you. Be familiar with your bloodborne pathogen exposure control plan, which your school should have handy, or Tom. And then just, maintaining good personal hygiene habits, hand washing and that. All right. Anybody have any questions? Go ahead. Well, they say right now, she asked how long would the hepatitis B vaccine protect. So they do say right now that once you get the series of 3, you should be protected for life. However, things in the vaccine world do change, okay? So we do find with some of the vaccines, they do wear off. For you, for me, it could be totally different. Mine could wear off in 5 years. Yours could keep you for 35 years. You know, so you never know. And usually what they'll do when you go in after an exposure is they will do a blood draw. And with that blood draw, it'll give them a titer and it'll say like, yep, you're immune. Yep, you're protected is what they'll do. However, there's some, I guess, they say not to have the Hep B titer drawn because the thought is that if you've been vaccinated, you are covered. Yeah, but then there's people that we vaccinated a physician 3 different series and never would be protected. So some people have that immune system that, you know, doesn't catch on to the Hep B too. So, but hopefully right now, forever. Anybody else? Everybody's ready to go to lunch? Well, some of you, I guess some of you have to stay, but thanks for your time, and I hope it wasn't too boring. I hope we can take some information out of this. Like I said, if you need your hepatitis B vaccine, we're up in the health department Monday through Friday, walk-in clinic 10 to 12, 12:30 to 4. All right, thank you.